Are you about to have shoulder surgery, something known as a subacromial decompression, where they're going to go in and shave those bone spurs off in your shoulder? A lot of times they'll also do bursectomy, where they take the bursa sac out. So what they're doing is the scapula, the shoulder blade here, this little portion right here, right? This is called the coracoid process here and the acromion process. They're going to go in here underneath this and shave this out and create more space. And they'll take that little bursa sac out of there. That opens up that area, because a lot of times what happens is we've had chronic irritation or inflammation from different tendinopathy conditions, and so what will happen is the ball portion, the humeral head, will ride up and forwards. And I'm exaggerating this, it doesn't go that far up and forwards, but it will go up and forwards a little bit, and that also will rub in there and cause those spurs to kind of tear away or chew away at the tendons. So go in there and clean that up, and if you need to have rotator cuff repair, they'll also repair the rotator cuff while they're in there, but that's just kind of going through that procedure with that, and that's done with small little portal holes. It's arthroscopic. They're going to make some small incisions there, small holes, go in there, fix that. For most people, a lot of times within, maybe 3 days or maybe less, you're going to be in a sling, and then the doctor's going to want you to go ahead and start doing some movement, some range of motion stuff with that, depending on if they repaired the rotator cuff or not. Now, if the rotator cuff is repaired, it may be a little bit different, or that is going to be different as far as the protocol. So some of your movement and all that's going to have to be, kind of work with your therapist on that or your physician. But if they did not repair the rotator cuff, then you're going to start with some movements, and you can start your light exercises. And a lot of times people, within 6 months or so, will say they feel really good. I think I read a study where it was talking about 90% of people after they had that procedure said it felt great. Their shoulder felt back to normal, full range of motion and functional usage. I've treated a lot of those patients that have had that procedure done, and most of them do very, very well. There are conditions and cases where that is a little more difficult. Again, that's if the rotator cuff was involved. So that's a subacromial decompression. Now, a lot of people ask also, like, is there anything I can do to prep for this? Now, of course, you want to talk to your doctor first and all that before you do anything that I discussed in this video. But if your doctor says, hey, go online, go to YouTube, find some exercises, or go on Instagram or wherever and find some exercises and some range of motion stuff to do before you have surgery, then I'm going to show you some of those things. The first exercise I'm going to do is take one of these pieces of PVC pipe. At home, if you just have a cane or broom handle, you can use that. And I'm going to take it out here. As far as grip-wise, I just grab it where it feels comfortable. We're going to say it's my right shoulder that's affected, so I'm going to use my left shoulder and arm to pull up, so you kind of see that may look like that where your right arm doesn't come up as high, and that's okay. I'm just going to go up as high as I can and back down. And I complete maybe 15 to 20 repetitions of that for a couple of sets. Again, you may irritate your shoulder because coming up like that can pinch that area a little more or compress it a little more. It's always kind of being compressed, but it can irritate a little more. And that may cause some pain, but I feel like, especially if you're going to have surgery, then it's okay as long as we're trying to maintain and you keep as much range of motion with shoulder flexion or elevation or reaching overhead as much as possible. So I'm okay with that, especially if the surgery is upcoming. The next movement we're going to do with this is going to be a little bit of what's called shoulder abduction. So I'm taking my left hand here, grabbing a hold of the cane. I have my other hand on the end here, and I'm using my left arm to push my right arm up as high as I can. Now, here's the trick with this that I like to do. So it's not just raising my arm out to the side. When I get up towards the top, I'm actually pushing with this cane and pushing my arm out. I'm going to feel a deep stretch. I'm going to feel it in the elbow. I'm going to feel it in the shoulder. So a good stretch there as I come up. And if it's too painful to go, past shoulder level with either one of these, that's fine. You can, the one that we did just previous, bringing it up, you can stop at shoulder level. And with this one, we can stop at shoulder level and push that cane out to apply that tractioning stretch to my shoulder. And again, I would complete somewhere between 15 to 20 repetitions of that for a couple of sets. The last two exercises we're going to do are going to be strengthening exercises using a band. So I have one of these resistance bands here. It's attached to our machine, but at home you can use these. They come with little sets that you can, fasten to the door, or whatever, have someone hold it. And you don't have to have the ones with the handles. You can also just use the regular exercise bands. They're pretty inexpensive. You're going to put your elbow by your side, and I'm going to bring my hand in to my abdomen just like that. That's called internal rotation. Now, here's the thing with this. If the elbow starts to flare out to the side, I will have my patients hold a little towel roll. I'll roll up a towel and put it in there to keep that elbow, kind of nice and tucked in. And I would complete somewhere between 10 to 12 repetitions for a couple of sets, one time a day. And now for my last exercise, we're going to do external rotation. So again, my elbow is tucked in nice and tight here. We have that same band here attached to our machine. and I'm going to go out as far as I can. You may not be able to go out very far, and I'm going to show a variation of this one, especially that's difficult for people, so I'm going to show you a variation. And I'm going to complete 10 to 12 repetitions for a couple of sets one time a day. Now, if you can't go out to the side, even with a light band, you can't go out to the side, or maybe you only bought one band and you don't have a lighter one, that you can use for this, tuck your elbow into your side, kind of keep this, my elbow's kind of at 90 degrees here, right? And I'm just going to step out. I call these walkouts. I'm just going to step out like that. I have tension on the band. I'm working the rear portion or the posterior portion of my rotator cuff as I come out, and I'm just going to walk out. And I would do the same thing, walk back and forth. And I would complete the same thing, 10 to 12 repetitions for a couple of sets, one time a day. Thanks so much for watching this video. I hope these tips help, and good luck with your surgery. Thanks so much.